So I am tasked with raising cancer awareness, and here in Northumberland we have quite a rural population, as well as quite a concentrated population in southeast of Northumberland. So sometimes I have to think outside the box on how I'm going to engage with people around some of the key messages. So these messages are around raising symptom awareness, and making sure that people know how to reduce their risk of getting cancer. So we'll look at some of the lifestyle behaviours that might increase your risk. So that's messages around smoking, diet, exercise, alcohol, keeping a healthy weight, and sun safety. So to get to talk to people, I use all sorts of venues. I go out into rural Northumberland. I might use village halls. In the summer I went to the county show to try and capture some of the people in our rural populations. In sort of the more built up areas, anything goes. Exercise classes, bingo halls, toddler groups, and we also have to try and engage with people that may be just harder to reach. So I've just recently done a talk for the learning disability community nurses, so that they can support the learning disability population with advice around the screening programs here. And sometimes I just set up stalls at information events as well. So I have a lot of leaflets behind me, lots of posters. And I also work very closely with the Better Health at Work Awards scheme here in Northumberland. And that's a great way of engaging with people that you would normally not catch because they're at work. And I do a lot of work in factories with the male population as well. So some of the key messages around stop smoking is that obviously if you can give up smoking altogether, that is the healthiest thing to do. But we have a great stop smoking service in Northumberland, and there's advice on all the NHS pages as well. And obesity is now the second biggest preventable cause of cancer. So smoking is the first, followed by obesity. So we give a lot of advice on how to keep a healthy weight, and this is all around the right diet and getting enough exercise. And the government currently recommend that we do 150 minutes of moderate exercise a week. And we also talk a lot about alcohol. So it's obviously no alcohol is the best option, but if we are going to stick, it's to stick to the lower risk guidelines, which are currently set at 14 units a week for men and women. And this can be a little bit confusing for people, so we often just say try and make some days where you're not drinking any alcohol at all, and try and space the units out, and just try and keep your regular just a low alcoholic drink, and sort of intermittent drinking with lemonades and soft drinks in between. And then sun safety, obviously it's a bit difficult to talk about that in January, February when I'm out and about, but it's trying to keep out of the sun when it's at its hottest, and making sure that you have enough sun protection on and you're regularly reapplying that as well.